Tierra Owen, what's happening? Welcome to Hangry and Horny.
So glad to be here with you, Tony. This is a great honor. Thank you.
Thank you for coming on. So we are in the backwoods here in Aptos, California, right? Which is just right next to Santa Cruz.
Yep.
Yeah.
About 10 minutes south.
Nice. So give me a little background about yourself. You're a nurse, and we actually met in London a few months ago. What was that like back
December of 2017.
Yeah, so almost a year. Almost a year ago, and through mutual friends with Chris Albert, who was a former guest on Hangry and Horny,
Yep.
and Shauna Alvarez, his girlfriend. You guys were talking during this London Real graduation dinner, right?
Yeah. And Shauna's also a nurse, so she and I just clicked right away. And then she said, "Hey, you got to meet somebody. I want you to meet this guy over here." And then she brought me down to you and said, "Hey, this is, I want you to meet Tony." And I came up to you and was like, "Hi, I've heard about you. I've heard you got some really cool stuff going on in Santa Cruz, and I'm from Santa Cruz. So gosh, let's meet up." And it went from there.
Yeah, it was really cool. You've been a big part of Magic Flow Bus, and it's just really neat to hear your story of being a nurse. You worked in like deliveries, right?
Yes.
Yeah.
Labor and delivery. Yeah.
Right. So how long have you been involved with that?
Let's see. Probably going on now about 20 years in a roundabout sort of way. I started out, it's actually a little bit further than that. I started out finding a book before I had my first daughter that just got me remembering that I had this experience when I was even almost a teen about having a little sister. And being that old, having another sibling, I was pretty cognizant of the process. I got to learn a lot about it. And so finding this book again when I was in my early 20s, I was like, oh, I remember this. I remember this is like something that was so interesting to me at this time. So interesting and passionate and connective, and having a new person come into your life. So with this memory, I kind of like put the book away, and I held on to that thought kind of inside me for a few years, and then I became pregnant. And so I had a little girl of my own, and during that experience, something clicked, and I said, this is the work I have to do.
Wow.
And so from there, it kind of evolved a little bit further into some trainings where I got invited to go to people's births and just be their support person, and then got officially trained in like how to do that well. And then went to another training that had to do with feeding babies and breastfeeding. And so during that training, I thought, this will just give me some more experience to be able to support women. And during that training, the woman that ran the training referred me to a woman that works at my current hospital and said, I think that this person would be a really good fit for your hospital in your lactation program. So they hired me there, and this is back in like 2001. And I worked there for 4 years. I went to nursing school while I was there working in their lactation center, and got hired right into their labor and delivery department. And that was like 13 years ago. So I've been there for a while. And it's just the love of my life. Like outside of my family, this is like my second family, my second home, and my passion.
Right. So what was it that clicked when you read that book, and then when you actually had your first kid, your daughter?
Well, this book was about home birth, and the sister that I was part of her birth, I wasn't actually at her birth, but I was like going to all the Lamaze classes back then with my stepmom, who when she was pregnant with her, and was just really close to the whole process and learning about it. So when I saw this book, and I had already kind of been definitely on a bit of like an alternative healing pathway in my life, and so I saw this book, and it was about home birth, and I thought, oh, this is how I want to have my baby. I'm I'm really interested in this, and this is something that's just such a natural process in life. Why do we need to be in the hospital to do this? So that kind of seeded with me. And then when I got pregnant with my daughter, my partner and I at the time decided, like, well, yeah, we want to have our baby at home. So that seeing that book, and what clicked for me was the importance of birth, and it being a natural opening doorway for people, not just women, but fathers and sisters and brothers too, into a new experience. And it's just something that we all do pretty much. If it's not something personally for you, you have usually a sibling, or you have somebody very close to you that you're involved in this. So seeing that, I was just blown away about how important this doorway was. And I said, hey, I want to get involved in this kind of liminal space, because you're kind of going in between two worlds here. And I want to explore that a little bit. So that was my opening, giving birth myself and seeing what that was all about. And then really kind of having the confirmation through that experience that, like, okay, I know where I'm supposed to be.
Right. Why did you think that these natural births at home or out in nature in some parts of the world, right, like got brought into the hospital setting? Like, where was that transition?
Yeah. Well, first, I guess I have to say, I mean, there is an importance for birth being in the hospitals some of the time, and actually most of the time, if that's where that person's comfortable. It really has to be like, you have to have a really low stress load when you're about to deliver a baby. And if there's any part of the environment that's making you feel more stressful, and the hospital does that often, but some people have so much trust and comfort in there, they're actually going to lower their stress hormones, actually just feeling safe.
Yeah.
But
in case something goes wrong.
Exactly.
Right.
Yeah. They feel like they have their comfort there. So it's important to honor that. But there's a whole history of the power of birth being taken out of the hands of the women and being put into the hands of male obstetricians. And it started quite a long time ago, but got very powerful as the Industrial Revolution developed, and even because it was a money issue for a long time, still people couldn't really afford to have births in hospitals, and so that didn't come along until later, and until insurance became such a big part of our lives. So over the 20s, 30s, 40s, 50s is when we really saw that power diminish. And you saw the very deep kind of drug-induced births that happened to people without any really power or control or really memory of what transpired during that time.
Some sort of like big business, pharmaceuticals, all that.
Experimentation.
Right. So, what something became natural, became like, we're going to give you a surgery, a cesarean section, and we'll take the baby out that way. We'll put epidurals in you, so like it became a little more invasive, and
or like, my time frame is not really being suited here, so we're gonna make sure that this process is sped up,
so we can do more.
We're gonna deliver by golf time, tea time, and that we're going to push on your belly really hard to make sure that your uterus is pushing the baby out, and just deliver the baby the way it's meant to come out, but with a lot of force. And
and then tools, forceps, and
surgical implements, like I said, like a lot of experimentation.
Right. And that just sounds really scary and freaky.
And that's why they used drugs a lot of times, like scopolamine, which we know is a hallucinogen, and it's not going to give you the kind of experience of reality during that time. And so you're going to have, maybe like not remember it, or you're going to think something totally else was going on.
Right. So, I mean, the baby's probably experiencing some level of that intoxication, right? Because they're still attached through the placenta.
Yeah. and trauma, right? Like, I mean, these weren't gentle experiences that these beings were going through, and not that, even the most beautiful births, I've seen some trauma experienced in them, but at least in many of those cases, there's like some intent that's quite different, and a lot of healing hands and healing support in terms of getting those babies out safely and well and taken care of by their mamas. I mean, it's really, I'd say, in that even while I've been working, like the last 10 years, 15 years or so, that we started actually handing babies to mothers right after delivery. No holding upside down, no drying off in between their legs and then getting their baby. Like, they come directly out and they go directly into the arms. In fact, most of the time, if the mom is very, if we can get her to focus enough, which most of the time we actually can, we tell her to reach down and pull her baby out. Like, once the arms and shoulders are out, reach down, get your baby.
Wow.
And put the baby on themselves. So it's quite a change. And that's even happening in the hospital.
Yeah.
And it's even happening with epidurals. So
Okay.
if a woman chooses that, there's no shame to that.
Right.
It might even be a compassionate choice in some instances. But it's a big difference from years ago.
Yeah, there seems to be a lot of invasive procedures going on, and they're saying all the baby's too young to even remember, and what are your thoughts on that? Do you think the baby actually remembers? Because I've heard some theories that, when people have these memories of alien abductions or something, that it kind of maybe mimics what the baby remembers, or the person has a memory of being birthed, and then you're in a sterile environment, there's bright lights, the doctor has a mask on, and they're like pulling, so the baby might have like a distorted, like, because they're just now opening their eyes and like seeing the world, and so they have a memory of it's an actual doctor.
Yeah, maybe like the glasses on or something, or make their eyes look real big.
Yeah, real big, and so it's like that's an actual pretty cool like hypothesis.
It's close, isn't it?
Yeah, right.
Yeah.
So do you think that babies have a memory of like that sort of event, or being in a wound, or
absolutely. I mean, I think that there's enough evidence of people having like recall through different experiences, that they either are in a trance state, or they're doing some hypno therapy, or been able to be in like deep meditation where they've had like recall of some experience that they're able to put together older in their life about what happened at their birth. I personally haven't had that, but even on the most basic level, the cognition of a newborn is nowhere near like even a child's. But is it like the most impressionable? Do they not have bodies full of neurons? In fact, when you're in your first year, you're like tweezing out like so many of your neural pathways. It's all about pruning. So I think that they're even like extra sensory at that time. So whether or how they remember it is probably a good question, but it's in their bodies.
It's somewhere, right?
Yeah.
Yeah, because there's the indications of like trauma being stored in the tissues. The quote is, the issues is in the tissue. So when people get like body work and they start to have like these emotional releases, or their body starts shaking, they don't know why. I think a lot of this stuff is pretty speculative. We're very into the alternative world, but there's some stuff there that can be a bit hoaxy. So like we were talking about earlier about like how your husband's an artist and a teacher, but he's like super skeptical, and he's like more on the like measurement data side, whereas you are a nurse, a scientist, but you're more on the woo side. So I think there's an awesome balance between you two, because there's a lot of stuff obviously that goes on, phenomenons in our life that it's a bit unexplainable, or people like to create stories or narratives around it. But the fact of the matter is, you got like a little human creature, a little being that obviously can feel. Yeah. Because they're crying or feeling something. You know, they go from some beautiful, warm environment to like the reality of the
Right.
cold reality of the
Yeah,
physical
cold, like
world, right?
painful pressures,
Yeah,
and yes, being stretched, having their limbs wide open, which they could never ever do before. Yeah, it's definitely stored somewhere in there, and who knows where it goes. I'm sure a lot of us have some unpacking to do around that because most of us were born in the age where birth was not being treated in the sacred way that it is in many places here in the United States, in hospitals. And so, yeah, there's definitely a sensation around that. And I think that, in terms of being woo woo, like, I just think that I entertain the possibilities of what can. What can happen and what is something to just kind of be aware of that we can take care of better.
right. Yeah, that these things, just like what science had uncovered in the past with things that we can't see, through measurements, they're able to show, and there's evidence behind it. Because our
Right.
senses just can't pick it up, right?
Right.
But certain animals can, or so I think, in some sense, like we're in agreement that these things probably are around. It's just that we don't have the measurement capabilities to
Right.
pick up on some of this stuff that happens through like spontaneous healings, or people have a switch, like even just like multiple personality symptoms, that they have diabetes in one personality, and then
That's
like they switch
amazing.
personalities and there's no diabetes there.
Yes. Yeah, a mind-body connection there, just so blatant and material.
Yeah.
Yeah, no, that's really amazing. Yeah, and just what we were talking about before in terms of science and like how we build the story on what we know. And we have to kind of know that that is like a version of story, that it's not fact. And, when we were talking about like kind of archaeological records and stuff, like, well, we don't have 99.99999% of the story because everything's gone from behind. So what we build on now, and yeah, we probably are getting closer every step of the way, but
Through like genetic testing.
yeah,
Right.
yeah. But don't you think we're like pretty far away still from like what
Yeah.
really happens?
Absolutely, and that's what people want people to know, is that you have a background in cultural anthropology.
Right, that
Yeah.
was what my bachelor's degree was in.
Yeah, so you guys studied like humans and their cultures and like ancient histories and that kind of stuff, right? So
Yeah.
fossilized records and
Yeah.
trying to put together like what exactly was going on with humans as we evolved, and
Yeah.
and then there's like the
Missing
narratives.
links.
The what?
Missing links.
Missing links, right?
right.
And the narratives around like religion, right? Which are in some way basically stories
Right.
that a bunch of people buy into and say it's truth, their own personal truth. Like
Right.
Neil deGrasse Tyson was saying on Joe Rogan recently, it was like, there's actual scientific fact, like truth, that's irrefutable by like a bunch of experiments and other people that are skeptical,
Right.
and they get the same data, experiment after
Right.
experiment, and then you have like what he coined as people's like personal truths. It's
Yeah.
like more beliefs, but
Yeah.
he's like, they believe it's true.
Yeah.
No one's gonna tell them otherwise unless
Yeah.
they have something else that shifts them
Yeah.
to realize like maybe I need to like question like my reality of what I believe is true according to this religion.
Right. Right.
And then some of these things are unexplainable, because I've had these holy shift experiences, and I wouldn't be able to say it was like some god or I mean, I've actually heard like angels singing, but I can't like I can only tell that story to people, but I can't get them to like believe me. Like,
Right.
I know it happened, but
Right.
it could be something that went on in my brain, or when I had an outer body experience, I had like a flu, and so the flu maybe induced me to be like out of my body looking down, like so.
Right, right.
But what was that, right? And
Yeah, or
that's
maybe you were just more open to the possibility of something giving you a message or having somebody that was guiding you,
right.
being in the flu. So
Yeah.
who knows?
Who knows?
So many possibilities.
I know, it's crazy. I was talking to Jordana the other day. She's on the next podcast before
Awesome.
you.
Jordana.
Yeah, Jordana Adler, episode 21. You're 22.
Nice.
And yeah, we were just sort of talking about like living in a virtual simulation. Like, I don't know. It just seems that when we're in these like heightened states of flow, where we start to see like patterns, right? And they say that like schizophrenics see like patterns all the time. So it's like, are we in a state of like manic schizophrenia where we're seeing things that are not really there, or are they really there? And like maybe we should pay attention to some of the information that people that have schizophrenia can see,
Right.
and there's certain cultures that value the feedback from people that are schizophrenic,
Right, absolutely.
So-
Yeah, there's a lot of cultures that take a lot better care of their mental health conditions than we do.
Right.
And actually treat them with reverence.
Yeah.
And help them through it as there is like a stage of like spiritual growth that's going on with that person right now. That person's actually really gifted.
Right.
And there's some leadership there, but we squash it.
Yeah,
So-
we see them all over inner cities. So there's people that are actually like homeless because they're maybe there's a bunch of factors. It could be addiction.
Right.
It could be they lost their job. It could be that they are just actually lazy.
Traumatic birth.
Traumatic birth. Yeah, abuse. Yeah, just all kinds of reasons. But you do see those that are walking the street and they're just like talking to like nothing, like they're like screaming out to the world, and you're like, who are they screaming? There's like nobody around them. It's like, and I could kind of relate when I was on like psychedelic medicines, right? I was like, oh my God, there's stuff around here, and I don't know if it's my brain or that's really there in another dimension. Can't prove it, but I can at least relate that maybe they do live in a world where they see these other beings around that we can't see. So
Right.
but back to like babies now, like right, because that's where it all starts, right?
Yep.
Like the miracle of life.
Yep.
You get to see that like on a daily basis.
Right. And never gets old.
That's amazing.
Yeah.
It doesn't become like routine or
Well, it doesn't become routine because every birth is different. It really, really is. I mean, just there is a ABC to it, pretty much. But
right. There's a protocol.
yeah, there's a process that's happening. And we always tell the mamas the baby always comes out. Because they lose faith in that completely. But the baby always comes out. But there's just so many variables in it, Tony. There's like just so many, there's so much inner exchange going on. Because I feel like my role is to be the guide in that situation, and not only just like, the hardest part where it's so painful or whatever for them, but like I literally love to like greet them at the door and like walk them to their room and like just sit down with them and give them a few minutes to like talk with me. And sometimes that's not possible because you have so a woman that's working really hard already, but still to sit and like really feel the energy and feel what's going on and feel like what they need. So yes, it is an interplay of a lot of dynamics. Like, what's her emotional state? Is she in acceptance of this? Is there any hangups or problems going on between the couple? Are there families involved? Are there siblings there? Am I in a really good healing whole day, or am I super lack of sleep? What am I bringing to the table? Who's going to be involved? Who's going to be my second nurse? And is that person going to be right for this family when I bring in that person? Who's the midwife? How is she doing today? Is she feeling like this is all going well? What's her sense of things? fear. Is there fear in the room? Is anybody kind of feeling like this might not be going well, or they're hesitant of what's to come? So there's all this interplay, and I mean, you could imagine like all of those variables, and there's a lot more of them too, change every single time, like so dramatically. And so that's the newness of it. And that's like what doesn't get old. It's so interesting.
Right. So that's the novelty, because every birth is different, right? Just like every person is different. And there is that process that you have your training with, but you also have like the context of your experience. So I imagine like your first time, there's so much feedback coming in. So it's hard to like distinguish what was what, but over time with the experience, you can kind of like see all these variables happening.
Right. Yeah, there's a kind of a discernment and like a protection even. Like, yeah, I've been doing a lot of qigong lately, and I just recently did a module on metal, and metal's supposed to be really good for healthcare practitioners because it's very protective. And it helps you to not pick up other people's energy when you're in a healing space and you're healing somebody that's got stuff to heal. So you're not like picking up that energy in you. It protects you and also helps them. Like you could think of like acupuncture needles are metal. And so that's like something that you can use to heal somebody and put chi through. But also protects you in like that touching process when you touch their body with the metal and it's touching you. So like, kind of thinking about that, like there's like a lot of growth and permutations through all this on like how to like understand the energy that's going on and how to like give the best, but not take it all on and have to like come home with like this heavy baggage at the end of the day, and also be really receptive at the same time, because this is a process that's like probably like physically and spiritually the most opening time in a human being's life. So that receptivity, you want to be really aware of that, and so that you can pull in and take in what you need to be able to be present and be that really great support for them.
Yeah, there's so many things coming to mind for me when I hear you talk about, the different energies and sort of discernment that's going on. What I feel like human beings should, like travel. Like all of us should have the ability to maybe go to the next town if possible, and kind of see like different ways of people are being in their culture or their neighborhoods, or if you're lucky to go to like another state or another country. And I feel like humans should also have a chance to like witness a birth. Like we've had that in like sex ed class where we saw like the miracle of birth, right? And we see like how like the process gets started, horny, and and then the development stages, right? And so I think about like the exposure of environment, so the mother and like the father, or if the father's even around, or like the type of nutrition that's happening. Like some moms like actually play music, like classical music around like the womb, the baby,
yeah.
And as it's developing, at what part does the baby's like first heartbeat happen? Like when does life enter the baby? That's always been a controversial subject, right? And but also like for people that actually, if they had an opportunity, not maybe see like a human birth, but like an animal birth, another mammal.
Right. Yeah, absolutely. And it's a miracle every single time, and it'll teach you lessons that you won't even get until you're there, and you won't get probably any other way. But yeah, I think that I think that like sex education in school should always involve a real natural birth and seeing that possibility there. In fact, it's kind of funny too because my husband runs a school. It's a middle school, and we were talking about their sex education there, and had talked to them before. I'm like, I want to show your kids a birth. I want to show them a birth. It'd be so great for them to see that. And so we were talking about this year as me coming in as a guest speaker and being able to field those questions, and be able to have them experience that, witness that, and see what comes of it, because I think, you have so much drama that you see in like movies and TV and stories that you hear. Like those are a big one because people love to tell stories about like their cousin's horrific birth experience or whatever. You rarely hear stories about like, oh my gosh, I saw this beautiful birth. It was in candlelight. It was totally silent. When the baby came out, it was in water. It was like, you never really hear stories about like
No,
that,
you only hear the Jaws version of
Jaws
birth.
version of birth. Yes, that's awesome.
Yeah.
I'm never going in that water again.
I know.
No more.
I'm never having a baby.
No more sex for me.
Yeah.
Yeah. So, yeah, I think that that's really an important thing. If you have the experience, if someone's invited you, if you have even an interest in supporting a family or a friend through birth. And, I got to say, men can be so good at it. So good at it. So, like, if you're a man and it's not your wife, but it's somebody close to you, or it's a family member or something like that, maybe you're not going to hang out when the baby's going to be pushed out, or maybe you will. But I've just seen men do like fabulous jobs at supporting women at birth. It's just really connecting with another human on a deep level and being there for them. A lot of it's just that quiet witnessing.
Right.
It's not about like telling her to do this or that, although there are methods and you can learn stuff like that. But there's statistics, and it's been studied really well about doulas. You know what a doula is? Like a support person, trained support person, right? That's what I did before I became a nurse. Just actually having someone sit in the room with quiet presence during a birth lowered the intervention and C-section rate significantly. So, I think that just says a lot about human connection and that we need each other, and that we need each other in a way that's supportive and accepting and not necessarily even active, just there for each other.
Right. Do you have, or is there any history of sort of pre-training before birth in like other cultures where they've like, I know they do that with the States now, where people can take classes, husband and wife or parents can take classes before the birthing process. So it's like preparing for that.
Right.
And are there indications of other cultures doing that where
I think if you're talking about cultures that are really westernized, I don't know exactly, but I think that's probably pretty similar to what we do here, which is a series of classes to get you to understand the process and get you to understand yourself, really. And like, what do I need through this experience? What do I think I'm going to be supported best by? But in more like indigenous cultures, they have people. Like they have people to support them through that experience, and they're much generally closer to nature and knowing themselves and how they are a biological being and what happens, and can kind of flow with it more. And also they have like a lot more adaptability in their life. They have to adapt to their environment more than we do. Having the comforts. And so that kind of just daily dynamic really supports birth, because it's just like, oh, holy shit, here comes this, and they can just kind of like go with it,
Right.
instead of fighting it. So, so there's a lot of work, and I think probably more Western in general, in terms of like dealing with pain, because we're so foreign to like having the uncomfortable be comfortable, which we talk about a lot.
Yeah, that's what I was thinking. Like, there's a lot of tension and like build up before the birth. Like, this was whether it's excitement or anxiety or all the above, right? And so I can imagine like the mother going in all pent up, whereas like these other cultures where it's just part of their day to day natural world.
Right.
It's like, oh, it's happening right now.
Right.
Like, there wasn't any like pre-performance anxiety going on.
Right.
Like, it was just like the body just totally synced up, and the breathing synced up, and there were people around, or they could just be in like a rice paddy field. I've heard those cases where they squatted when they gave birth, right, versus being in that sort of a natural
lithotomy position is what we call it.
Yeah.
On your back with your legs in the air.
Yeah, right. Like, that doesn't sound very logical to me,
Or powerful, right?
Yeah, right. Like, you have
Because
all these
birth is a really powerful experience, and yeah, you can change the position of it a lot and have it not be.
Right. And then there's the option of having water birth, as you indicated earlier, right? So there's many ways to go about it. My thought is like, the difference in mindset going into the birth between like the Western world versus like the rest of the world.
Right. Yeah, it's true. And I think, what we see, I see a couple of different things there. Like, we have a lot of field workers that come up and like deliver at the hospital, and it's pretty stark. Like, if you're really just somebody that has not lived here for long, you or maybe don't even have residence here, you're just working here and you're just getting by, but your life has definitely been a little bit harder, and you can see it. You can totally see it in the people that come in, and they come in labor. You don't even know they're in labor because they are so stoic in their face. And you don't even know that the baby's coming because they're so stoic. And then you're like, oh, holy shit, I better get some gloves on. I better get my baseball catcher's mitt ready because it's going down right now.
Yeah.
So that happens a lot, and that's a thing. There's something about, like I was talking before, about adaptability to the environment and having had conditioning for like hard experiences in your life, and it just like plays out right there with the birth.
So field workers, meaning like people working out in the farms, or
probably people that came over from Mexico.
Yeah,
and
labor
are here either legally or illegally.
Right.
I don't know often.
Yeah, and they have a different like mindset or presence going into it, where they're just calm and stoic.
Yeah.
Wow.
Yeah, it's pretty obvious. And then so here's the stark opposite, is that we have women here that are highly educated. They're very mind oriented. They think a lot about their birth. They have a lot of intention for their birth. They write down what they want their whole birth to be like. And they intend a very like natural childbirth. Don't offer me any drugs. And they get here and they're completely unprepared for the level of intensity that they're going to get.
So it's kind of ironic because they're like planned to the T.
Yep.
And then it goes all out the window.
It's all like, it all totally goes the opposite.
Yeah, and it's interesting because it's, to me, like a grand performance of life. Like, this is the stage, and you're delivering a new life into the world, and you're like in that way a performer in the act.
Yeah, absolutely. So that it's funny. I mean, you wouldn't, it doesn't always work out like that, but I'd say more times than often, like that kind of like planning and taking all the right classes and reading all the right books and maybe watching the cool videos often doesn't get you ready for just being in the moment with things and letting your logical mind go and not trying to control anything.
Yeah.
Letting your animalistic side come in is very difficult. And that's the way that you really can get through birth, is letting yourself be crazy, because it's very animalistic and it's very crazy.
Right.
And I just tell women over and over, let yourself be crazy. You're safe here. You know, it reminds me. We have that other
No
friend.
wonder you're laughing when you heard Hangry and Horny the first time. Right? Because this is cool,
Yes.
because in that environment that you work in, you're like, yeah, there's no PC going on, like politically correct. It's like you're in a safe space. Anything goes. Just let it out. It's part of being human. You don't need to like buffer anything, right?
Yeah, absolutely. Absolutely. So, and you know, when you're talking about like newness and like, do I ever get tired of my job? Not tired of my job, but like, does it ever become routine? Like, one of the things that actually does happen on our unit quite a bit is that, you know, you'll have visitors that are, you know, in the lobby or whatever, or you may have like somebody come by and visit you or something like that. Often at my job, you have like a howling woman that's just down the hall from you. And it's pretty intense, you know, but all the nurses are walking around like, oh, that's fine. You know, like
Yeah.
we almost don't even, we don't hear it as a stress call.
Right.
You know,
Right.
whereas an untrained ear, let's say,
Yeah.
would be like, "Holy shit, what's that?" You know, like
Right.
that person needs some help right now.
And you're like, oh no, that's
They're
just
okay.
normal.
It means
Yeah.
the baby's coming, actually.
Yeah. Yeah. You're like, oh shit. Everybody's like all cool and calm, and you know.
Yeah, maybe eating their lunch.
Yeah. Yeah. So it's not like you guys are checked out or dissociated from it. It's just like you know, it's like, yeah, this is the natural process. This is, yeah, like you said, that means the baby's coming out.
Right. So it may signal somebody, hey, you should go in there because they're ready for you.
Right.
But it's not a stress call. Yeah.
Wow.
Yeah. I know it's pretty funny. So yeah, not routine. And there are protocols that, you know, that we do have to follow, and my manager shouldn't hear this, but she probably will, is that, you know, I do my best to follow those the best I can, except for that, you know, if there are things that just need to happen in a birth that, you know, might not be beautifully perfect to the protocols, I'll try to just kind of squeeze them in the protocols some gorilla type way.
Yeah, it's like the way I see things, or they're like guidelines, like including law, right? Like, because most people, they have a moral compass like in there. If you had like some kind of at least a conscience, you know, an experience, like, or people that were good like guides and mentors, you kind of learn like, you know, it's obvious you don't go around killing people unless it's just like self-defense or something, right? So it's like there's laws in place for people that are just complete idiots, you know? And so like there's guidelines that are there for, you know, structure and like just make sure the safety, right? And so you have to have that like awareness, a situational awareness that it's hard to, like, I guess you can train for it. I mean, when I was like learning how to skydive for the first time, like we learned all the safety protocols, and like it's like, what do you do when this situation happened, and flash a picture in front of your face, right? And it's like, oh, you need to like, you got to be able to make the decision quickly, and what do you do when this happens? So the ability to sort of be trained for it, but also be flexible at the same time, where like what intuitively comes up that you might have to say to somebody, like to be able to like have them push through the pain,
keep them safe or whatever it is. Yeah, there's interpretation for sure in those protocols, and I think we all do our very best to serve women and families safely, and so, you know, like you're saying, you know, we'll use those protocols mostly around like the safety factor.
Right.
And yeah, that's really an important and interesting thing that you said around training too, because you know, we train a lot in our jobs. We have a lot of different drills that we do, and there's things around safety like that they're muscle memory. Like you do this job long enough and you know exactly what to do when there's something that's not going right, and you don't even really have to think about it that much. Or even think about it at all.
It's in some ways like, so there's training to the point it becomes natural.
And
so when the moment happens, it's just instinct. And that's why I love like the concept and living in flow, because like if you get out of your head, like your body just kind of knows, whether it's like learning a new movement, right? We get out of our head, we're learning a new dance routine, or, you know, a new skill. and it's amazing to see the body just actually doing it on its own. And when you're like, I'm coaching people, I'm like, just everything I said, I'm giving you cues, but the moment we step in front of each other and actually, like, for example, do kettlebell partner passing and like throw cannonballs at each other, like, let go of everything I just said and just trust that your body will just know.
Yeah.
And I imagine, like, after like nursing, the same, you know.
Right. Yeah, you do. And you get into things where, especially with babies, where you're trying to save a baby, where it's just very quick and very very automatic. And I think it's really, it's really important, who we know in common is Brian Rose. And we had a conversation when we were in London together about how important it is for, because he saw he had recently had a baby, like when we met up, and he's like, Tierra, I just see how important it is for those like nurses and doctors to just be so like on, and they need to be on in their game in life so that they can come to there and be so present, because like, man, they make one wrong decision in some of those critical moments and it's a life or death decision. So we, kind of, which gets me sort of on the topic of kind of talking about where I'm going with my work in terms of nurses and self-care. We just talk about how you really need to have your game on 100% so that you can get into that flow.
Yeah, exactly. Yeah, be ready when the moment happens, and make sure you have enough sleep. And,
stay ready. Really,
stay ready. Yeah, I mean, that's the beauty of all the emergency responders. And unfortunately, doctors, police officers, firefighters, like they have these crazy shifts. And as much as everybody can say that they can operate on very few hours of sleep, like a lot of these errors are happening because of lack of sleep, and maybe because they're not eating a certain way and not like exercising, taking that self-care. So before we dive into that, I have like another question with like the protocols. And
I'll talk about birth all day. So
throw
them at me.
I was curious because like in the military, for example, like they try to follow certain processes and protocols and structures, but real life throws you stuff that you may never seen or they've never seen in all the years of wisdom and battle and all this stuff. So the ability of the leading person, the leader, to go back to their leader and explain why they made that decision, the ability to communicate. So it's like it may have gone away from the protocol. But at least they have this space to say, hey, this happened, I had to make this decision quickly, this is why it ended up bad, I take full responsibility for it, or it ended up good, we need to like build this into the new protocol. Is that similar in your line of work?
So similar. In fact, it happens in real life and it happens in drills. So we drill intentionally for certain outcomes. And in those drills, we do like a mock-up or a sim. And so we've had some pretty good like sim robots too that deliver babies and bleed and all this kind of stuff, and either are pink or white or whatever in terms of having blood in their bodies. But so we'll do a couple of sims and then we always debrief. And even we debrief a ton in real life situations too. So we'll debrief and we'll like go, okay, what well, okay, what do we need to work on? And we'll find these holes like in the process. And we've found some pretty big holes that we've been able to like make better by going through these situations. And what's great is that the hospital that I work at, Sutter Maternity and Surgery Center, I'll just plug it, is one of the most amazing places on earth to have a baby. It is got a fantastic culture. We've worked really, really hard on having good culture. So there's not a lot of hierarchy. We all work really well as a team together. And who really the leader in the room is the person who takes charge. It could be a nurse. I've seen it be a nurse many, many times when there's a doctor in the room. And there might be some like co-leadership in terms of like that doctor is really in charge of the mom and the nurse is taking care of the baby or whatever. But that lack of hierarchy and that work on collaboration is just fabulous.
Yeah, everybody checks the ego at the door.
Oh, man.
Right.
And so it really helps you to find processes that work the best and have the best outcomes. So we've done a really good job at that. There's been a couple of situations when you said, like, having to take the story back to your manager or the administration, like, what the hell happened there, And I see those situations just being like social situations. Like, we've had some situations with visitors, people that come in that just want to take control of everything. And they tell you can't do things that you typically are doing to keep people safe, and then having bad outcomes because of that. And so what has to happen in situations like that is you just have to document really well that you did the best you could, and you did attempt to like do these things to kind of make the outcome safe, and you were thwarted at every turn because that person, and people have autonomy, right? Like, if a mother says, like, I know I'm hurting too much. Like, I don't want you to put like that monitor on my belly right there because I need a second or whatever. Like, we're not going to force them into it. They're autonomous human beings. We have to support that. But usually people are really reasonable. And like, if they think that there's possibly a problem or whatever, especially a mother towards her baby, she's like surrendered completely. Like, do whatever, make sure the baby's fine.
Yeah.
So those protocols are really interesting, and it's been a cool way to work with people in a culture like that, to be able to develop processes that work for the best outcome.
That's great. What about what's going on with people? I've seen it with my guy friends, fathers, and of course, like, mothers have been sort of shifted because they've been carrying this baby the full term. But the moment the baby comes out, and the parents are forever changed. Like, something switches, like, where they become a little more selfless about themselves, and it's not about them, it's about their children now.
Yeah.
And like, what's going on there? Do you see like a light come on, or some sort of like aha moment for these people?
I feel so blessed to have witnessed like that so many times.
And of course, your own personal experience too, having 3 children. So.
Yeah. I think that there's a lot to like unpack with that. Well, we're put here as humans to like grow old enough to have children, right? And like, that's kind of like a purpose for us as our species to like move on. And then we're sustained by growing old enough to be able to raise our children to do the same, right? And that's basically a life cycle. You could die after that, that's fine, right?
Yeah, that's a reality, right? Of Mother Nature.
Yeah, exactly. Right? So like, that's really animalistic way to look at, or not really animalistic, I guess it's humanistic too, but like, it's just the basics. But
a human animal.
Yes, the human animal that we are, animals. The hangry and horny human animal.
Humanimals.
So so I've seen that switch. I've seen it. I recently got to experience seeing a couple of dogs have a bunch of puppies too, and my friend that had these dogs was just noticing so many changes in them, being dogs having their puppies. And so it was reminding me a lot of what I see in humans, but it was just so basic with them, and like outstanding because it's so different. Because these dogs weren't very old either. These dogs were like maybe a year and a half, so they're like puppies having puppies kind of. And puppies, they're rambunctious. They have like a ton of energy, especially the males, just like human animals. My human animals particularly.
Oh yeah.
But
savages.
Total. Wear that kid out. So so she was witnessing like, especially the mom had the 5 puppies, and she kind of like cordoned off like with the puppies by herself for like, oh, I don't know, maybe a number of days. They kept the male away from them actually for a while, but she said she'd never ever seen the likes of this before when the male, who is always rambunctious, savage, came in to see the puppies for the first time. She said she'd never seen her dog like this. Like tiptoed in there, like so quietly, so cautiously, so carefully, and like just so gently. And she said it was just amazing to see, and that was like what could transpire inside of that dog to change that much and to know that much. And so it's like on that most basic level, it's like, we know what to do. Like our bodies know what to do. I can't imagine the cascade of hormones that had to take place inside of that dog to be able to act like that. And so the same with fathers. I mean, there's not too many times that, you see men cry, and I've seen so many men cry. And that's a huge hormonal cascade too. Like, what's transpiring? And all of the dads that cry, they always make me cry. And like, you think I've been a nurse doing this forever. It's like I always have to like turn my back and pretend I'm doing something else so that I don't like fall into that. So
it's a big tear party.
It is. And it's so beautiful. You almost just want to disappear at that moment because you want it. It's so intimate, and you want them to have that and share that. And I think most of the time, honestly, they don't really care. They're just in their zone and they are having their moment, and they don't even really notice like who else is talking or what else is going on in the room. So that goes from, this beauty, and there's this dance that happens, and with the dogs, it was similar too. It was like the mom really kept the puppies, and it was her thing, for quite a number of weeks until the puppies were up and on their own and running around a little bit. So in humans, it's so much like that too. It's like, and I think that that's the part where we really have to educate more is how to be a couple when you're early parents, and know what's natural and know what is needed. I think a lot of times the dad just feels like they're so in love and they're so into it, but like they don't have a role. She's there breastfeeding really often. The baby cries and responds to her smell and sound like so completely. And so they often have this like time that's difficult where they feel pushed out. And although the mom is like, there's no conscious action of her doing that. And so she may feel like, oh, he's not doing enough. Like he doesn't really care, or he gets to sleep all night. There might be some resentment. So it's really important before you have your baby is to like work on your issues. And so that these kinds of things don't arise without conscious knowing of what's going on.
Preemptive in a like sort of I guess positive way, it's like you're prepared for these kind of emotions to happen, and this is like the natural process to expect that may happen, and most of the time it does, right? Like this is the mother's tending to the baby or babies, and the father is like, now like, what do I do? Like she's probably not obviously feeling horny,
right? No horny,
and so he's just sitting there going like,
what's my job? Yeah. And there's lots of things that they're so great about coming in and like, oh, the baby's done feeding, let me change the diaper, or let me like hold the baby while you try to get some sleep and this kind of stuff. But because we live in such a different world that's not tribal anymore, it's not village based, like there's no other like
support
dads or uncles or his dad or whatever saying, oh, son, it's like this is so normal and this happened to me, or that the grandma's coming in and taking the baby for a few minutes so that they can go for a walk together, or whatever it is, that village mentality will support the relationship as well, right? Because that's only good for the baby and for the growth of that life and for that life to repeat itself. So it does does take a village, and we don't have too much of that going on in terms of households and the way we raise children anymore. So yeah, I do say a lot of those magical moments to bring it back, and it's a powerful biological process. It's really, really cool to see.
So some sort of instincts that are coming through. Like
something gets switched on.
Something gets switched on, like
and off, I think too.
Okay. And what's your sense of time? Like going into flow and time dilation. Like, does it just go timeless? Does it speed up? Does it slow down? Like, what's your reality like when all this is like going down?
Right. Okay. So I'd say from like an insider's perspective, if you're the one that's delivering the baby, it's pretty trippy. Like that. The time should go out the window because you are so absolutely focused on this work that you're doing. That's really in the moment. I can remember a couple of instances where I was, in labor, giving birth, and just being like, whoa, it's like, it got dark out. Wait, the sun's rising? Wait a second. Like it was like 2 a.m. or whatever. How can the sun be out now? So like the time feeling like it's going by fast. And then like the, even though like a contraction supposedly lasts like anywhere from 60 to 90 seconds, like there's like a world in every contraction, a world of pain, a world of adaptability and intensity that like is not 60 or 90 seconds. It's like a place. It's like a thing that you have to do and go through, and you repeat it over and over and over again. So it's a really trippy experience about time because you're totally in flow in labor. If you're like letting labor happen, if you're fighting it, you're totally not in flow. Like any flow experience, right?
Right.
From the outside, like it can be kind of trippy like that too, where like if you're maybe a very close intimate person to that mother, you might experience times pretty close to that level too. As a provider, I find that like I can definitely get into that, especially if I have somebody that's working really, really well with labor and I'm like right on the floor with them. Like I'm doing all the contractions with them. I'm breathing with them. I'm helping them through that, touching them. Like you can just get right connected into it. So it must be a vibe. There must be some kind of like vibration that's there that you're working with that it's like you're jumping on board, And so, and I don't know if you found this with body work, but there's like almost like a blissed out type of experience that you get where you're just like riding this wave of like being connected to another human being and helping them. That used to happen to me like quite often doing body work and massage where you're just totally blissed out. And so
especially like afterwards, like during I'm like really present.
Okay.
And sometimes like in the beginning you're like syncing up and you're watching their breath and you're like
matching breaths.
You're like asking them if the pressure is like too much, too little. And then there's a moment where like maybe they're talking a lot and then you just hear this like big sigh and then they like drop into this other space. And you're at the same time synced up in that space too. So you're like fully present moment. And then you realize like, holy crap, like time just flew by. We're done.
I didn't even do their legs.
Sometimes that happens, right? You're just like, and they're just feeling amazing. And then at the end, like you part ways and then there's this sort of flood of what's been coined helper's high. So anybody in the service industry, whether it's a nurse or a massage therapist or even just customer service, whatever, you're volunteering. There's this like really addictive feeling that you get from helping people. And I forget which organization it was, but that was a big deal. Like I think there's more research being done on like what type of neurochemicals and hormones are being released when somebody actually helps people. and so it is that bliss feeling for sure.
Yeah, absolutely. Absolutely. Yeah. So there's definitely been some moments of time dilation. And I think that a lot of times I won't get to be at a birth like that. So like every opportunity that I have, I'll go for that. And, we're lucky in terms of that, the way that we make assignments for our job in the morning when we start out is pretty, it's pretty sharing, like we know that there are certain, because my unit's actually very interesting in that we, a lot of hospitals will take women and they'll have like a laboring unit and then they get moved someplace else after they have their baby. And we just, you get to your room, you have your baby, you stay in your room and you stay your hospital stay. So we, for whatever it is, a couple days or whatever. And, so our nurses, so there's an intensity to like taking care of a laboring woman where you don't have any other patients. You just do the birth. And then if there are not enough of those to go around, then you take like a mother baby couplet and they're both your patients, and you'll probably take like 3 of those. So you'll have like 6 patients. So we share, like we know that there are certain ones of us that really like to do labor, and there are certain ones that like really don't, and they'd rather do babies and moms. So, so everybody knows me and knows what I like. And they're like, oh, Tierra, you'd be great for her, so that way, there's a good like matchup of like patients to nurses to kind of see what will work best.
Okay. On the woo side.
There we go again. Woo woo.
Woo woo. Yeah, I mean, you talked about energies earlier, and, I want to kind of let the audience know, like, we're actually electrical beings. I mean, there's diagnostic tools in hospitals. Everybody's familiar of the EKG or ECG, as some people would call it, for the heart rate monitor. So that's electrical. It's a signal coming off of every individual's heart that's hooked up to that monitor. There's also brain waves, right? So that's electrical waves in the brain. And then there's muscle waves or connected tissue waves. I mean, that's EMG, the brain's the EEGs. So, when you're talking about like things like chi, that's kind of like a language of like the Eastern philosophies, right? And so what exactly, how would you define like energy or chi, like being a nurse? When you're witnessing a human being, it's basically a sum total of all their energies, which is the brain, the nervous system, the heart, and then all the organs and muscles, or all muscle tissues and bones, and skin. So, that's a collective energy battery, if you want to look at it that way.
Absolutely.
And so when you're dealing with a mother or like a new baby that's coming out, like there's like heat coming off of these things, these little creatures, right? And so what's your concept of energy, and like how do you apply what you know through like studying qigong and some of these Eastern philosophies, and how do you apply that to nursing?
Well, one really good, and this doesn't have to do so much with woo-woo or energy, is one really good outcome of me being able to study martial arts in general, I would say, is that it's supported my body really well through nursing. Like, we get into some funky positions, and I know how to move correctly so that I don't hurt myself. A lot of nurses I've seen over the years injure themselves. So that's like an aside, but like I'd say any of you out there that, are thinking about doing nursing, like, please couple it with some kind of body movement practice that's going to support your knowledge of ergonomics and how to properly move the body in space so that you don't hurt yourself. I had comments from lots of doctors and midwives over the years. It's like, why are you standing like that? I'll often get in a bow stance when I'm like pushing, right? Because I'm using my legs. You know that from massage, right? Why are you standing like that? And it's like, well, here, let me show you. Like, this actually works really good for your back. So,
and you're not a big person,
right? Right. So, we get in having to like move people, and it's like, oh, okay, well, you know what? I'm going to be smart about this. I know, even though your legs are anesthetized, you can move your upper body. So I'm going to let you pull, and I'm going to help with, this other person, and then we're going to help you move. But yeah, so that's been a really, really great thing. Also, when you're using proper body mechanics too, like energy flows, right? So not only like I might be like in this bow stance, and I don't know, I think in yoga, is it called like warrior?
The warrior
yeah,
stance,
yeah. Okay.
or the warrior pose.
Yeah, or sometimes
right.
they call it like a long stance or a stride stance. Anyways, your energy can move from the ground like through your body really, really well. So if you're touching, or if there's like any intent like that, like those kind of that position in particular is a really good way to like send energy from the earth to the patient. On the other hand, like looking at our humans as energetic beings, looking at my patients that way, I'd say that one thing that I'm really particular about doing in my practice is walking into a room and kind of zeroing my energy out. And I can be like doing something super like frantic, or I'm not frantic, but sometimes it gets so busy where you're just like, okay, gotta do this. And then I'll walk into a room and I know that like I've been called into there for like a delivery or something, and like just standing by the door for just a second and taking a couple of just slow breaths and like just grounding that energy right down to the earth, like let it go. Okay, here now is like totally brand new moment, totally brand new like world. I kind of look at that as there's like a little universe going on in that room, and I'm going to enter that space really carefully. And then depending on what's going on in there, I just really try to read it all. And I think that it's just helped me. And like, I don't know if I'm going to speak in terms that like make any kind of like academic sense in terms of qigong or any kind of Eastern studies, but the way that I see it and feel it is that I'm just looking at everybody, and I'm sensing where they are with their energy, and I'm finding my place. So what's missing here? What needs to be added? What's maybe not so good, and maybe I can balance it a little bit. All this is taking place consciously, but then there's some kind of unconscious things I think that are going on with me in that too. So depending on where the family's at, like I had said before, like I really try to get a sense of them. And I mean, I don't want to be sounding too weird, and I don't say this too often, but like I will see what's around their body. I mean, like checking out like auras or whatever it is, like it's more of like not as much of a visual thing to me as it is a sensing thing.
Sensing,
yeah,
right? A
like,
feeling.
Yeah, it's like, oh, not so close, back off, or get in closer. Like there's a pull there. They need you there.
Yeah. And you can see body language too, right?
Right. Yeah. So I think that that's the way that I work with that, and sometimes it's just so, Tony, it's so obvious and so tangible that like you just have to come in and like really touch and really love and really be that specific about it and outward about it. Sometimes it's a little bit more of like, I got to tiptoe in here and not really be visible, but be ready when the ready time comes. So there's all different ways. And I think when the baby's born, like, yeah, there's almost like an explosion. I mean, I know that sounds kind of crazy, but the heights that happen when that baby comes out, and that newness and that life, it is just giddying. It just throws you for a spin of like, wow. So I mean, being that like kind of that blank slate that they're not. They come in with that birth experience. They come in with that in utero experience.
Right.
But there's just so much potential right there.
Yeah, and it's tangible. Amazing.
Yeah.
So on the self-care side that you're now putting out to the world for nurses and other people that maybe are in the service industries. Can you like go deeper into that? Like what inspired you to start doing that?
Sure. I have to give my husband a little bit of credit here because he knew that I.
What's up, Rob?
Thank you, honey. So he knew that I was super interested in branching out from my work, and he knew that I was really interested in health and healing. And I was just kind of coming up with, well, here's going back a little bit further than that. Like, so I attended a class through London Real called the Business Accelerator. And so I knew that I wanted to do something. And one of our assignments that Brian gave us was to create 10 vlogs in 10 days, right? And so I just kept putting out these vlogs that had to do with like paying attention to yourself, taking care of yourself, being a mother and taking care of yourself, being in relationships and taking care of yourself, being with other nurses and taking care of each other. So these vlogs kept on like hitting these points. And so I kind of looked at all of them, and I looked at the comments that people gave me around them, and so my husband said to me, he's like, I just don't think that there's like anybody out there that's trying to help nurses take better care of themselves, and that seems like a really empty spot. Because you see all these like the shift work, right? And you see people having problems with sleep and people having
weight problems.
Yeah, exactly. Health problems, dietary problems, just a lot of stuff. Right. They don't socialize because they're just so burnt out and they're kind of stuck in their house on their days off. So he's like, you just keep vlogging about these ideas of being like helpful and offering like different mindsets for these nurses. He's like, I just think this is a great niche. You should really look into it. And so I think within like, it maybe even already happened. I think it had already happened. I said, that's it. And I know the name of the company. It's called Nursing Ourselves. And he's like, oh, nursing ourselves. That has a ring to it. We could all do that.
Yes.
So that was kind of the birth. And there was like a little bit of a backstory even to that too, because getting into Brian's program or class.
I'm sorry, you're burning up here.
You know what? I know. I was like scrambling from, I might even like switch spots with you.
Yeah,
to
absolutely.
that, where like the sun could be at my
Yeah,
back
for
more.
sure. You want to do that? Let's do that. Yeah, let's switch over.
Oh, thank you, Tony.
Yes.
Fair Irish skin.
Yeah.
Thanks you.
Yeah.
So this is like really going on right about a year right now. Like we had the eclipse, right? A year ago.
Mm-hmm.
We had like the massive fires up in Santa Rosa. And we had the triad of the big old hurricane that happened down in Houston, right? Those three things happened like right in a row, like within a month. And there was something about that time that was like, what the hell is going on? And I ended up going to a Michael Franti concert.
Oh, right.
And just, he came like into Santa Cruz. It was like, I think actually he's coming again. It's like the end of September. And just got out there with people and just like, as typical is at his concerts, just danced.
Just
and
let loose.
Oh, yeah. And there was just like so many stories going on. Like he would stop and tell a story, and then like he would like have like my kids went up on stage with them and all dance, and I saw these friends that like I didn't even know were at the concert. We were all hanging out. It was just like this really big like release. And so, like, it was the very next day that I signed up for the course. And I was at work, and I was, like, practically shaking. Like, I looked at it. I watched his webinar. I've been watching a lot of his videos.
The London Real Academy course.
For the Business Accelerator course.
Yeah, Brian Rose.
Yep. And I like saw him like talking about it, and I was like, holy shit. Like, this is what it's leading me to. Like, all these changes, like me feeling like I wanted to do something different from what I was doing. And I called up my husband. I'm like, I think I'm going to like sign up for like this business course. And he's like, do it.
So Rob, yeah.
I was like, okay. I'm like, well, so you're gonna be okay with me like spending? I'm gonna have to like spend hours, doing like study and like homework assignments and stuff, and like, you're good with that because it's gonna like change some dynamics and stuff. And he's like, do it,
Do it, do it.
It was totally like that. I mean, it was a little bit more like in depth, but like he said that a couple times to me. It's like, okay, I'm gonna do it. So anyways, that was kind of how that all like got started. And so everything really else unfolded from there. Like I started meeting people around the world that were nurses. I started meeting people all over the country. I got to do like a really fun affiliate program with another nurse that works on the East Coast that's doing a similar thing.
Okay.
People call me up that are nurses like from time to time and just want to chat with me and like, kind of let me know like what they're up to, and or either wanting a little support or help, or maybe they're even on some kind of a wavelength that's similar to mine, but has a little bit of different flavor.
Okay.
So I've just gotten to meet so many people, and there's been so many projects that have been born even from this. Working with a group of people, I think all of them are London Real graduates too, called the Radiant Group, and we put on a WellCare Summit up in Canada last year. That was pretty like
in BC,
in Tofino, BC, pretty like health provider focus, but not all. Some people were artists and doing their photography of all of us there, and some people were like movement experts. But all focused on WellCare. All focused on WellCare. So there's been a lot of birth to it, and it's helped me to grow more too, and kind of finding out like what's my best audience and how can I reach people. So the growth arm that happened from that was that what I see a lot of lack in terms of self-care is what we were just talking about before, is new mothers with babies.
Yeah, you just like read my mind there.
Yep. And them taking care of themselves, because I talk to you all the time about like how interesting it is to be a mother and what I get to do in terms of trying to do like the best job of like feeling gratitude all is offered to me in terms of like raising my children and being a wife and being a career
like
person,
so many hats to wear.
Exactly.
And then a business, and
not pushing it, like not like not trying to force things to happen, because they all have this incubation embryonic period before like there's an obvious burst forth. Like that day when I joined that class, like that was one of those times where there was like some incubation and some things happened, then it was like boom, there it goes, like that. Now it's birth, and now you have to do something. So waiting for those cues from the universe to tell me it's ripe and it's time to give birth. So seeing these postpartum women not really knowing how to care for themselves in this newness, and never having to have somebody that's so dependent on them. And so I've written this little book that I'm working on. I actually made a goal for myself to finish it by the end of September, and it's called 52 Ways to Love Yourself Postpartum. And so, that love yourself and caring for yourself, it's like all wrapped up into one bundle. And I think that there's a lot of like empowerment needs there. Like postpartum depression is a really big thing, and it's been kind of swept under the rug. It's starting to like have some awareness around it now, but I think that it's partly a really big thing because, one, we don't have that village support that we talked about for many generations now. Two, there's not really a very good education around the process of like, what do you do? How do you relate? How do you relate with your partner? How do you relate with your baby? How do you relate with the outer world? Um, and also, there's just not very much empowerment in the woman in general in terms of like, this is an amazing time, you know? So I think that we have the opportunity to actually talk about something called postpartum bliss as well. I think it's very attainable for a lot of people. It's a mindset change, and not to belittle or devalue that people don't have postpartum depression, because it's a real thing. But I think that with those three things that I talked about in terms of it not being a great time in women's lives, is because we can support those things so that you can have the environment of having an opportunity for bliss and gratitude during that time. So this little book's an offering. Like, it's 52 ways you can look at it to allow yourself to be empowered, to take care of your emotions, and also give you some just practical tips on things to do.
That's
So,
cool.
yeah.
As we wrap up, can you elaborate more about like having that like long-term vision process versus like short-term, like especially being a mother? You like kind of talked about like even your own fitness goals of like 3 weeks to shredded abs, you know, like you hear this all the time of people like wanting like to get results quick, but it's not sustainable. And then how you wake up an hour early, like although you can get 8 hours of sleep, you choose to get 7 so that you actually have an hour of your own alone time before you have to take care of your kids, your husband's needs, your work needs, your own business needs, pick them up from school, the kids, all that stuff.
Right. Long-term vision, I think, is just such a, it's just like such a basic, you know. And I think that our culture has a hard time with long-term vision. Everything has to be the quick fix. Everything has to be get rich quick. Everything has to be the magic pill. So, you know, I mean, we know, right? We know these things are generally, well, they're almost always never true, you know, almost always never, but they're really not true. So
it takes work.
It does, and
effort,
slow and steady wins the race.
Yeah.
You know, so that if you're always developing and you're always growing in your life, this lifelong learner, it's just like, well, who really cares if there's this like amazing like wrapped up present at the end of it or not? It's like, you know, it's the process is what you did as you went along. So, you know, more about the path and the way, and like what I'm working on is developing this business to be something that I can grow human capital out of. Because I had many years where I just really wanted to go back to school. And I mean, I have 2 degrees. I have one in nursing and I have one in anthropology, like we said. But I really wanted to go back to school and be a midwife. I really thought that that's what I wanted to do. But I realized that I already am a midwife, you know. And even though I'm not the one that's like got those letters behind my name, it's like it's a bigger vision than that. And I midwife people not just in birth, too. I midwife people in just birthing themselves. So I think that is, you know, this calling that I had to want to go back to school, but I just knew that it wasn't really in the cards in terms of the time that it would take me and pull me out of like the career mode that I was currently in into something else and not be able to support my family as well. And I have a college-age child already that, you know, we're helping through school. So like all those pieces were not fitting together. How can I create human capital? Like what would be something that I could do? Well, you just have to educate yourself. You have to keep growing. And so I thought, well, if I learn along my way and create a business and put some kind of outlook on it that's maybe going to come to maturity when my kids are becoming an adult, then that would be a way for me to like move out of the hospital and maybe attain some kind of relationship with the hospital, maybe on some contractual level or maybe on doing support and self-care for the hospital. But like retire, and not really retire because I don't really see myself like as in a retirement, but like grow into more of like a consulting sort of phase where I could travel a lot more and be meeting these people. Whereas now, I feel really bound to this land that we're on because, I'm here. That's that's our spot. That's where we have our family. That's where we raise our children. So although I do love to travel and will do so occasionally, I see myself more as being a little bit more freed up to do that with my husband as our kids are older and maybe in colleges or starting families themselves.
Right. So
long vision.
Yeah, long vision.
Yeah.
And basically you like to sort of work consistently over time instead of like doing things like quick and fast. You're just consistent with your workouts. You know, you even talked about like learning like when to rest more when you feel fatigue, syncing up with like the menstrual cycle. You're gonna run these experiments, where you're like, why is it that a certain time of the month am I like really tired?
Or my GI's all fucked up. Like,
right.
Like, why does that always happen on day 22 or whatever that experiment is?
So there's like many different forms of PMS symptoms that they're now discovering, and each woman has to really sort of take notes and track like day one of the whole cycle of the menstrual cycle and all the way to like the end, and then see like what the energy levels are and like how much time did you sleep, what did you eat, did you exercise, did you just take a nap, like all these different things of self-care that you're now tracking so that you get a better understanding on how your systems work,
and how to support ourselves and know ourselves better.
Well, Tierra, that was an awesome time. How can people find out about you? How can they reach out to you?
Oh, yeah, absolutely. Well, you can come to my website, which is nursingourselves.com. You can shoot me an email at tierra@nursingourselves.com. You can find me on Facebook at Nursing Ourselves. I'm on Instagram too, Twitter, LinkedIn, all the same name. So yeah, please reach out. Let me know what you're doing. And I just love to connect with people that are like these lifelong learners like yourself, Tony.
Yeah, the lifestyle, right?
Absolutely. On various fields, various subjects. So like if there's somebody out there that maybe is doing something totally different than me but sees a link up, like I want to talk to you. Awesome. I want to know more about what you're doing.
Well, thank you for coming on to Hangry
Thanks,
and Horny.
Tony.
Thanks for being Hangry and Horny with me.
Oh, yeah.
All right. Thank you, everybody.
Yeah, thanks.